about 10 to 20 minutes. Go ahead, Aisha.
Hamjambo. Thank you for giving me this opportunity. I'll first start by saying community health volunteers in the house, you stand. So we are going to sing our Afya song. Anyone willing to come in front? Julia, come, so that we sing together, and we are also going to sing with the other group. So the song goes like this. I'm not very good in singing, but Julia will help me. So, Julia.
Okay, community health volunteer, you know our national anthem, Afya Yetu. We can start. Afya yetu, jukumu letu. Afya yetu, jukumu letu. Ndio, ndio. Afya yetu, jukumu letu. Ndio, ndio. Tukiwa na afya vijijini tuna afya. Tukiwa na afya vijijini tuna afya, ndio. Tukiwa na afya vijijini, tukiwa na afya vijijini, tukiwa na afya vijijini tuna afya. Afya yetu, jukumu letu. Afya yetu, jukumu letu. Afya yetu, jukumu letu. Ndio, ndio.
Very much, Julia. Before I speak on behalf of community health volunteers, I'm going to recognize one of the volunteers who was honored by government. So, Beatrice, you are welcome. You just greet people, and then we can move on. Beatrice, you are welcomed. She was honored, and she's going to introduce herself.
Afya yetu, jukumu letu, jukumu letu. Okay, mmesikia ya kwamba I am Beatrice Iminza Mwashi, HSC from Makadara, na vile wamesema hakuna kuongea masaa, si ndio? Langu tu ni moja, ya kwamba mkubwa wetu wa afya hapa amesema kwa Manassas, teamwork. Sisi kama volunteers, when we are working, we teamwork. But ikifika ni hapa, tuko wapi? Kwa mtandao yenu, tuko wapi? Since wakati wa Professor Anyang' Nyong'o, tulikuwa tunaitwa Nairobi, Home Based Care Alliance Nairobi. Wakati huo tulikuwa tunaitwa Community Health Workers. Wakati tulipeleka hizo documents kwa meza ya Anyang' Nyong'o, ilitolewa hiyo W ikawekwa V. Since that time, katika pipeline yenu, volunteers tunakufa, volunteers tunazikwa, mapanya zinatukulia mochari, hakuna mtu anatujua. Tuko wapi?
Thank you, Beatrice. As you have heard, it has been a very long journey since we started as community health volunteers, and the government only recognizes us when it comes to giving our monthly reports. But after that, we are nothing to them. They don't respect us. They don't care whatever that we can be awarded, either as a stipend or as a gift, or either just something small for whatever work that we have done. So it is just that sad. We have had several bills, And most of these bills, they are not favoring at all. They are just talking about certificate. We have volunteered for a long time. We have those ones that even don't know how to read and write, but they have been giving monthly report. So it is just unfair when you hear a bill is there on the table and it is not recognizing, it is talking of certificates. Where will we get these certificates? And yet we have been volunteering for a long time. We have been saving lives. We are doing great work. So we are here to cry. We have been left alone and nobody cares about us. The journey has been moving, and from out of those bills, there is one bill that was moving and it was enacted. After being enacted, we moved, and community health volunteers, they were vetted, and we were promised we were going to get a small stipend. It was also launched on 4th of October last year, and we thought things were moving well, but it is unfortunate up to this time as we are talking, nothing is being talked. We even met with Dr. Oluga, and he was not, he said he doesn't know how much we are going to be paid. He talked of being paid, but when we asked about the money, he said he doesn't know how much we can be paid. So it is just that unfortunate to us that we don't know where we are heading. So we are here to cry. We are doing voluntary work, which is more even than volunteer, that is working. As we are talking, we were vetted, and after being vetted, the files, our files, they are still at the sub-county offices. They have not even moved to City Hall, so we are still just left in suspense. So on behalf of community health volunteers, I'm crying. It is not easy. You have heard, we are the backbone of the community. We are the pillars. We do raw data. They feed the data, and after feeding the data, they get credit and we get zero. So as I speak, I say, just look into our matters so that at least, even if it is something small, it is better than nothing. We struggled for a long time, more than 20 years. Others we started when we were young girls. Now we are grandmothers and we are still struggling. So if they talk of certificates, where will we get the certificates? And we never went to school. We have the knowledge, we are wise, and we can do it better than those ones who have certificates. Thank you.
Thank you, thank you. I think just to politicize what Aisha has just said is to say even the language around volunteerism